This is 97.7 The Bolt, the Your Care, Our Mission show here on 97.7 The Bolt, and I am joined now by Victor Bycroft of the Humboldt County Memorial Hospital. Welcome, Victor. We are here today to talk about the survey that you guys send out. Do you want to talk a little bit about this?
Yes, I would. Talking about our patient satisfaction survey that we send out almost on a daily basis, and want to just go over briefly how that process works, when people can expect to get a survey, how often, and why it's kind of important to us. So if anybody out there, if you've had services done at the hospital of any type, if you've been an inpatient and stayed overnight, if you've been in the emergency room, if you've had one of our outpatient services, chances are very good that you have gotten a survey from us. Getting that survey, getting it filled out and sent back to us is very important, not only to us, but to the patients and the people of the community. And I'll talk about that briefly in just a little bit. But first, well, how that survey gets done, how it gets sent out. If you've come in and you've had services, and it's the first time you've been there for any of these services, you can plan on getting a survey in the mail. Anytime that you do a different service, if it's you've been in and you've done lab, and then you come back in and do an inpatient, you're probably going to get another survey. And I know people worry that they're going to get these surveys too often. Well, one of the things that we do through that system, if you've had outpatient services of any kind, you're not going to get a survey any more than any 90 days. So we have people who come into lab every week to get blood drawn. They're not going to get a survey every week for that, which makes people feel a little better, because I know the surveys take time to fill out, and people's time is valuable. So we try to pay attention to that, but no more than every 90 days. Now, the only thing that will change with that, if you've been an inpatient and then you do outpatient, you'll get 2 surveys. If you've changed addresses within that time, because the system matches up name and address to say this person's already had one, so I'm not going to send another. So if you've had that, you'll probably get another survey. But we really do ask that you fill that out, because it is very important to us that those get done. That patient satisfaction survey is the perception of the patient on how well we have done as a hospital and how well we provided those services. And it's important to us because it helps us to fulfill our vision. That's to be the region's healthcare leader, providing the highest quality service to you. And if we don't know how well we've done, we may think we've done fantastic, but your perception is, well, this wasn't so nice. And it looks at everything from the admission process, every encounter through your visit, all the way up until the time that you leave the hospital. So all of those things are important. We want to make sure that they're all taken care of in there. If we don't know about it, we can't fix it. So we're just going to assume that everything was fine if you don't tell us. So that's important to the patients, because it tells you that we're looking at that. We want to make sure that you get something good out of that. The data all comes back in. It's through a company called Press Ganey. When that data comes into us, then we're looking at that on at least a monthly, if not a weekly basis sometimes, to see where are we doing well, where do we need to see improvement, and what are the trends? Is it going up? Is it going down? And where do we need to focus our efforts, and where do we focus our initiatives? So that helps us to tell us how we're going to do better for you every day. Another aspect of that, and we don't look at it so much yet because it doesn't affect us yet, but as we move forward with what changes in healthcare, the government, CMS, which is the Center for Medicaid and Medicare and Medicaid Services, is constantly looking at how are they going to save money. So they're looking at the quality and the service that hospitals provide. So they'll be looking at those patient satisfaction scores to say, are you doing a good job, and are we getting good value for the money we're putting into this? If they find places that have low scores, then they're going to say the value is not so good, so we're going to cut the percentage that you're doing, that we're going to give you. Now, for a critical access hospital such as us, that doesn't matter yet. It's not affecting us. Large hospitals, it's starting to see that, and they'll see a 1 or 2% decrease in the amount of reimbursement they're going to receive. Every one of those programs eventually rolls down to critical access, so someday it will come to us, but we're going to be prepared. And our primary objective is that we're going to do the right thing for the patients. That's why this is so important to us, and that's why we ask that when you get that survey, please take a few minutes and fill it out, send that back in so we can know how we did and how we can better serve you.
All right, awesome. We're going to take a quick break here on 97.7 The Bolt, but we will be back with the Your Care, Our Mission show by the Humboldt County Memorial Hospital to talk more about the survey process and some changes that are coming, as well as more things happening at the hospital.
My name is Jack Dorn. I'm a physical therapist at Humboldt County Memorial Hospital. As a certified vestibular therapist, I can assist in the diagnosis of people who are having dizziness, vertigo spells, where a person feels like the world is spinning and they cannot stand up straight or upright and can even cause nausea and vomiting at times. The most important thing with dizziness and vertigo is to diagnose it correctly. So you can treat it correctly. Once properly diagnosed, the treatment can many times be very easy and a person can have a very fast recovery from their symptoms. If you are having problems with dizziness or vertigo symptoms, especially if you get dizzy rolling in and out of bed, turning your head in the car, looking up at a shelf, turning your head when you're shopping, all you have to do is call your physician so they can contact our outpatient therapy department to schedule an appointment. And the appointments usually last about an hour. If it is a certain problem, they can only 3 to 4 treatments. A lot of times we can get rid of all the symptoms and problems that they're having.
Call Humboldt County Memorial Hospital at 332-4200 for quality care close to home.
This is 97.7 The Bolt. We are in the middle of the Your Care, Our Mission show, brought to you by the Humboldt County Memorial Hospital, and I'm joined now by Victor Bycroft. We just talked a little bit about this survey. If you've been to the hospital and received services from them, you've probably received a survey from them, and we talked about why it's so important and how it helps them, but there are some changes coming to your survey process, correct, Victor?
Yes, there are. The biggest change that we're going to see very soon here is with July encounters, we are changing our survey process and we are going to what is called HCAPS. HCAPS stands for the Healthcare Consumer Assessment of Hospital and Provider Systems. I always forget what that stands for. But that is a standardized survey that is done by the Centers for Medicare and Medicaid Services. It was developed through them. And it's a way for hospitals across the country, large and small, to be able to basically do an apples-to-apples comparison of the service that they're providing. That survey is 32 questions long. It is standardized. It's very simple to fill out, but it does give us that chance, as I said, to look and see how are we doing against other hospitals. And we can do that because that data is compiled and put onto a healthcare website called hospitalcompare.gov. And so we're able to go onto there, pull up hospitals, and see how are we, as Humboldt County Memorial Hospital, doing against others in our region, in the state, and in the nation. So that's going to give us a good opportunity, once again, to provide that better service and see how do we compare and how do we improve as we move forward. So that's going to be very exciting for us. Just a couple of other things going on at the hospital, really going around the ambulance service, and it's basically just to say a thank you to them and let us know the wonderful service they're providing. Yesterday we had a crew go down for Ragbri and set up and do a way station, basically providing as people were coming into Fort Dodge if they needed any assistance. So very happy that they did that. And then, of course, we have the fair coming up starting today. And so all of the major events going on, we'll have the ambulance out there for those to provide for anyone that happens to need that. So just a big thank you to our volunteers and the ambulance crews, and we're really proud of them.
All right. Thank you, Victor, for joining me this week on the Your Care, Our Mission show here on 97.7 The Bolt.